body uses a special sugar called glucose as a fuel to power all the cells of our bodies. And remember too that the cells use a special chemical called insulin to control just how much glucose there is and how well the cells can use it. The cells have these little doorways in them that the glucose must use to get into the cell. But glucose can't get in without a special key, and that key is insulin. If there aren't enough of the keys, enough insulin, as in type 1 diabetes, then glucose can't get into the cells and it builds up too much in the blood and causes damage. But in type 2 diabetes, the problem is in the cells. There's enough insulin, but there aren't enough doorways.
So, either way, the glucose builds up too much in the blood and causes lots of problems.
Exactly.
आपको कितनी देर से डायबिटीज़ है?
25 साल।
आपको पता कैसे चला कि आपको डायबिटीज़ है?
मेरे पाँव में दर्द थी और मेरी टांगों में दर्द थी।
और फिर आप डॉक्टर के पास गए?
मेरी मम्मा ने मुझे डॉक्टर पे लेके गई।
और फिर आपको पता चला कि आपको?
जी, मुझे फिर पता चला मुझे।
और आपको डायबिटीज़ होने की वजह क्या थी?
परेशान।
और
मैं परहेज नहीं करती थी।
किससे? मीठे से या?
मीठे से।
बाहर के खाना?
ना, मीठे से।
डायबिटीज़ के बाद आपको कौन सी मुश्किलात का सामना करना पड़ा?
सबसे पहले मेरे पाँव दर्द करते थे, फिर टांगे दर्द करते थे, उसके बाद फिर कमर दर्द थी।
कुछ कराती हैं आप उसके लिए?
हाँ, अभी भी जाती हूँ ना, फिजियोथेरेपी करवाती। मेरी आँख दर्द करती थी तो मैंने ऑपरेशन करवाया। सर्दियों में मेरी स्किन खुश्क हो जाती है, जिसकी वजह से मैं एलर्जी की दवाई खाती हूँ।
Health experts also worry that because of undiagnosed cases, the actual number of diabetics in China might be even higher. According to Liu Hongfang, the Associate Chief of Internal Medicine at the Dongzhimen Hospital in Beijing, the reasons for the growing number of diabetics range from increasing obesity to lack of exercise to poor eating habits. She estimates that more than 90% of the diabetics in the country suffer from adult-onset diabetes, a form of the disease specifically induced by those three causes. And, like many experts with first-hand experience of the diabetes epidemic in China, Liu expects the problem here to get worse as living standards continue to improve.
As China's economy develops further, more and more people can afford to buy high-fat foods in their daily life. As a result, the number of diabetics will keep on increasing.
Now, you mentioned some of the factors, so let's explore how it affects different people differently in China. So how is it affecting different segments of the population, say old versus young, urban versus rural? Who's most at risk?
Well, I think everybody is at risk. Firstly, I think those people who have a family history are extremely at risk because it is a genetic disease, and these people, when they're exposed to these environmental factors, they're more likely to decompensate. So those people who've got a family history need to be screened, and they need to be particularly vigilant about their body weight, about their lifestyles. The young people who got diabetes, they face disease for a long time. And again, these people are more likely to develop critical illnesses during their prime of life. So a lot of the time, these people are less sort of are more complacent. But in fact, paradoxically, people who get diabetes young are actually more likely to have a problem in their middle age. Now, on the other hand, there is an aging society. So, you know, the fact is 1 in 4 people will develop diabetes by the age of 65. And the question is, why do people get disease earlier? And this is, of course, where the genes and the lifestyle comes in.
Right.
But also, with aging society, we're going to see more people with diabetes. And that is compounded by frailty and other comorbidities, like those heart disease and even cancer, for example.
It's easy to see then that the economic, social, and human tolls of this disease are devastating. And for many in China, a diagnosis can mean financial ruin. Take Ge Xuanju and her young daughter, for example. Every month, her family spends roughly 2/3 of its overall income caring for her diabetes.
I have to spend more than $290 every month to treat my disease, and it's a big burden on my family.
Whatever the most effective treatment options are, some health professionals now believe that as China continues its march toward becoming a developed country, the best way to forestall the diabetes epidemic will be to educate the public on how best to avoid becoming diabetic in the first place.
We should tell everybody about this disease. That's the only way we can effectively control the spread of diabetes.
On the way to become the diabetes capital of the world. There are already 70 million diabetes cases. What is the reason for this? It is lifestyle or it is hereditary?
See, it is the mainly lifestyle of sedentary lifestyle, as well as the high carbohydrate which we are eating day to day in our food habit also. Okay. But if you ask me, the genetic and epigenetic, both factors are responsible. The genetically, because we have a low birth weight. So by birth we are thin fat Indian, and which is the reason we are highly insulin resistant. And I mean, this is really a comparable data, because the average birth weight of an Indian child is around 2.5 to 2.8 kg, while the Western world it is around 3.2 to 3.3 kg. So lot many more things are to be done for prevention of diabetes. But I will say here is the lifestyle modification is one of the important way by which diabetes can be prevented.
But if you were to take a ratio between lifestyle and hereditary, what would be more?
So I mean, lifestyle is a major reason. I don't say the genetic reason is not there, as I told you. So okay. Genetic along with that environmental factor, which we call in our term epigenetic factors, they are equally responsible.
Say that India is primarily a vegetarian country.
Yeah.
See, I don't know how many vegetarian, non-vegetarian, but as per my clients' data, I would say 60 to 70% are vegetarian. And vegetarian food is naturally high in carbs. Yeah. And the protein, there are only 2 protein sources for vegetarian, which is pulses, which are actually high in carb, and you have milk protein. Okay. So then what they are left with? They are left with nothing. Whereas non-vegetarian has additional sources of eggs, chicken, meat, fish. So you will never see a non-vegetarian person eating a meal without a meat or a chicken or fish or breakfast. But if you see a vegetarian diet, what will they have for breakfast? They'll have tea and upma. It's carbs with very little protein. What will a non-vegetarian eat? Chicken, eggs and toast, which is actually a balanced meal. So we have given up our traditional way of eating, which is milk and upma. We think milk is poison, so our proteins are going down. Because of this unawareness of healthy diet or how the diet has to be balanced, we are facing this problem of diabetes, along with genes and along with lifestyle.
Incidence of diabetes in India is now increasing in younger and younger population. Before few years, it used to be a disease of 50s and 60s. Now this had become a disease of 20s, 30s, and 40s.
Earlier it was the disease of rich man, now it is a disease for everyone.
Now even the poor and middle class are having more and more diabetes. Because it is
become very secular.
It's so we think it's a disease of riches, which is wrong. I presently have 2 staff working with me and they both are diabetics. It's actually genes are a very big factor plus lifestyle.
They're diagnosed much later. They're living with diabetes, and they don't find out until later in life. Is that right?
Well, even in America, there are over 54 million people who are pre-diabetic. There are over 7 million so-called undiagnosed diabetics. So the thing is, and a lot of people think that because they're skinny, they can't have diabetes, so they don't go get checked for diabetes.
Right.
कि बेसिकली ये जो इलाका था बर्रे सगीर पाक व हिंद, ये यहाँ पे कहत बहुत ज़्यादा आम थे क्योंकि खुराक की कमी का शिकार हो जाते, खुश्क साली हो गई, कहत साली के अरसा गुजारते थे। तो सदियों पहले इंसान के अंदर कुछ चेंजेस ऐसी आई जीन्स के अंदर कि वो जब खुशहाली का पीरियड होता था, जब कहत साली ख़त्म हो जाती तो खुशहाली के पीरियड में उनको जीन्स कहते थे कि पेट के गिर्द जो चर्बी है, फैट, वो जमा हो जाती थी। जो पेट की, क्योंकि ताकि जब कहत का ज़माना आए तो वो जो चर्बी है एक एनर्जी के सोर्स के तौर पे इस्तेमाल हो सके।
ये ऊँट की कुहान वाला
जी, वो उसी तरह से समझ लें। तो अब ये हुआ कि वो कहत सालियाँ तो ख़त्म हो गई, ग़िज़ाई कमी उतनी नहीं है बल्कि ग़िज़ा वाफर मिक़दार में, लेकिन वो जीन एग्जिस्ट करती है, वो जीन मौजूद है। जो एनवायरनमेंट है वो कहत साली वाले नहीं है। तो अब ये है कि इंसान खुराक खाता है, वो जीन उसको खुराक को पेट के गिर्द, जो पेट कमर के गिर्द जो फैट है, पेट की जो फैट है, ये सबसे डेंजरस फैट समझी जाती है। यानी किसी की वेस्ट लाइन का ज़्यादा होना ये एक रिस्क फैक्टर है उसको हार्ट डिजीज़ के लिए भी, डायबिटीज़ के लिए भी। तो हमें वो जीन मौजूद होने की वजह से इस इलाके में, तो हम जब तर्ज ज़िंदगी हमारा बिल्कुल तानासानी की तरफ गया तो हमारी जो टमीज़ हैं, पेट्स हैं, वेस्ट लाइन वो ज़्यादा होनी शुरू हो गई। तो यही एक डायबिटीज़ होने का रिस्क फैक्टर। तो वो उन लोगों के अंदर कल्चर नहीं है किसी भी फिजिकल एक्टिविटी का। वो बेचारी खातून खाना घर के काम काज को अपनी उसकी एक्सरसाइज का मुतबादिल समझ लेती है कि मेरी तो बच्चों के पीछे भाग के और वो इर्द गिर्द फिर के मेरी तो घर के अंदर ही मेरी एक्सरसाइज होती है। हालांकि ये एक्सरसाइज नहीं है, थकावट है। और दूसरा ये होता है कि उस बेचारी खातून को बच्चे खाने को देती है, बच्चे खाना छोड़ते वो बेचारी उसी को ख़त्म करना पड़ता है। तो वो जो ओवर ईटिंग का जो कॉन्सेप्ट है वो है ही नहीं है। और दूसरा जो मैंने देखा है, मर्द और फीमेल जो दोनों हों, हमारे मुल्क के अंदर लोगों को अवेयरनेस नहीं है कि मेरा नॉर्मल वजन कितना है।
It is tied to the lifestyle. It is lifestyle. लेकिन मैनेज का पता है प्रोटीन ही है। आप अपने काम कर रहे हैं जैसे इनके अंदर ग्लूकोज की भी जरूरत है। ठीक है, आपका लाइफस्टाइल में आती है एक्सरसाइज, लैक ऑफ एक्सरसाइज,